MLT Case Study Series 21. A case study on the topic. Unveiling the Shadows of Kala-Azar, a clinical journey from diagnosis to recovery. Navigating through the complexities of visceral leishmaniasis with advanced laboratory diagnostics and therapeutic interventions. Introduction. Kala-Azar, also known as visceral leishmaniasis, is a severe form of leishmaniasis caused by protozoan parasites of the Leishmania genus. The disease is transmitted to humans by the bite of infected female phlebotomine sandflies. It affects the spleen, liver, and bone marrow, leading to fever, weight loss, anemia, and enlargement of the spleen and liver. Without treatment, it can have a fatal outcome. Case study. Diagnosis and management of Kala-Azar. Patient presentation. A 34-year-old male from a rural area endemic to Kala-Azar presents to the clinic with a 3-month history of fever, significant weight loss, fatigue, and abdominal distension. Physical examination reveals pallor, marked hepatosplenomegaly, and lymphadenopathy. No significant travel history outside the endemic region was reported. Diagnostic workup. Complete blood count, CBC, reveals pancytopenia with hemoglobin of 8G/DL, white blood cell count of 2,000 cells/L, and platelet count of 50,000 cells/L. Bone marrow aspiration demonstrates the presence of mastocytes, Leishmania parasites, within macrophages. Serological tests. RK39 immunochromatographic test shows a positive result, confirming the diagnosis of visceral leishmaniasis. Polymerase chain reaction, PCR, used as a confirmatory test, detects Leishmania DNA in the blood sample. Treatment. The patient is started on liposomal amphotericin B, administered as per the World Health Organization, WHO, guidelines for the treatment of Kala-Azar. The total dose is divided over 5 to 6 infusions on alternate days. Follow-up and outcome. The patient shows significant improvement after completing the treatment, with resolution of fever, weight gain, and reduction in the size of the spleen and liver. Follow-up CBC shows improvement in pancytopenia. The patient is advised on preventive measures to avoid sandfly bites. Discussion for medical lab technologists. Understanding the diagnostic tests. CBC. Pancytopenia is common in Kala-Azar due to bone marrow suppression caused by the parasite. Bone marrow aspiration. This is a definitive diagnostic test where the presence of mastocytes and macrophages confirms the diagnosis. Serological tests. RK39 test. This rapid test detects antibodies against K39 antigen of Leishmania donovani and is useful for field diagnosis due to its simplicity and quick results. PCR offers high sensitivity and specificity, especially useful in cases where microscopy or serology is inconclusive. Role of medical lab technologists. Medical lab technologists play a crucial role in the diagnosis and management of Kala-Azar. They are responsible for performing and interpreting CBCs to identify hematological abnormalities characteristic of Kala-Azar. Processing and analyzing bone marrow aspirates to detect mastocytes. Conducting serological tests and PCR for the confirmation of Leishmania infection. Ensuring quality control in the laboratory processes and results interpretation. Conclusion. The case study of a patient with Kala-Azar highlights the clinical presentation, diagnostic approach, and treatment strategies for this potentially fatal disease. Medical lab technologists are key in the timely and accurate diagnosis of Kala-Azar, which is critical for the effective management and outcome of the disease. Through understanding the laboratory diagnostics and their interpretations, technologists can contribute significantly to the battle against this neglected tropical disease. Thank you. Please subscribe for more videos.